time to have questions and so on. In this, I'm okay with the presentation. Okay, in this topic, I am going to speak about airways and problems that can mimic obstruction, but are from a pathological point of view. I want to start with a sentence that is important for me, where art meets science. Science is radiology, because radiologists are a little bit like artists, part of the medicine. But where radiology met the pediatric, they are soul. This is soul of the radiology and the medicine in general, the pediatric part. In this picture on the side of my sentence is a picture called Mother and Children, and I am very proud to have this picture in my collection. It's from Ibrahim Kodra, and I think that represents very well what I am going to say now. And it's just some art in this conference meeting. I think it's not bad. Another thing that I want to share with you is this barcode. This is the barcode of the official page of Center of Education Albania, part of World Federation of Ultrasound in Medicine and Biology. And we are proud to have a Center of Education in Albania in this field. So if someone is interested in this, can visit our website. Imaging data in pediatric emergency, presentation of cases and literature review, because a lot of patients, you know, that sometimes the more than half part of patients in the emergency room are for respiratory disease. So this is an important topic. And I will go to show you a series of special cases of airway obstruction in pediatric ages as a result of pathological findings. A pediatric patient is not an adult in miniature. Their diagnosis is always a challenge, and I say this even in the last presentations. Which are the most important cases that bring a patient in pediatric emergency room? Respiratory emergencies are the most important, abdominal emergency, neurological emergency, and traumatic emergency. We're going to talk together today about respiratory emergency. The most important part of the respiratory emergency and inflammatory disease, allergic disease, or obstructive airway pathologies. About the obstructive airway pathologies, we have always to exclude or to confirm a foreigner body in the airway tree or a pathological obstruction. We're going to talk together. In pediatric ages, it often happens that congenital anatomical abnormalities or certain conditions of the children debut with parenchymal pulmonary changes as a result of compression of the respiratory airway. When a child presents to the pediatric hospital with recurrent respiratory tract infections or an acute failure, there is always a need to exclude concomitant pathologies. In this presentation, we will reflect the cases of some patients who presented in our emergency unit with acute respiratory problems, diagnosed with accompanying anomalies of complications of concomitant disease. For example, the first case is a 5-year-old girl suffering of recurrent pulmonary infections who was diagnosed with esophageal duplications. We show you the imaging of CT scan that show the duplication in the picture. And also a very good imaging is the esophagogram. This examination is performed with the fluoroscopy and giving to the patient oral contrast enhancement. And you show the deformation that and the obstruction that esophagus can have in this situation, and the duplication, that is the cystic structure, without contrast enhancement, and the mass effect that this cystic formation give to the esophagus. And to the trachea also. And for this reason, the patient comes several times in emergency room with pulmonary pathology infection, but the third time that she was in our emergency room, they decide to bring it to us to perform a more accurate investigation and to diagnose the child. In the barcode, we have the link of the publication that we have made together with surgery and with the pneumologist of this case, because it's a little bit rare. So we can visit the publication also. Here is another interesting case. Carcinoid tumor of the trachea in a 11 years old male child presented with pneumothorax. Pneumothorax and pneumomediastinum. The child came in our emergency room in bad conditions. We firstly perform a chest X-ray where we see the pneumothorax and pneumomediastinum, and then we perform a chest CT scan. And we saw the obstruction that the trachea have because of this mass that we see here. And we perform the CT scan and the reconstruction in the picture here, that we see that is a very important mass that impacts the trachea, the lumen of the trachea, more than 19%. And we perform a surgery to these children, and also we find from the anatomical pathology department that was a tumor, carcinoid tumor, very rare also. Here we have a 1 year old child who had multiple respiratory infections and who was diagnosed with aberrant subclavian arterium. 1 month before, we have another child with the same pathology, but I didn't include in this presentation because my abstract was before of this, but in the next presentations, why not? You can see the reconstruction, and you can see that the subclavia didn't go through the correct track, but have a breach, and in this way the airways was in trap and can't be extended like normal, and this is the reason that the child have this recurrent infections. Here is another important imaging finding with esophagogram also. This is a child that this is the child, 2 years old, with recurrent pulmonary infections, and we perform firstly an esophagogram in the first picture, and you saw that like in the first time, the esophagus is lumen is reduced and the esophagus is compressed about the effect mass, but this time not from the duplication like in the first patient, that is a cystic formation. In this case, is an aberrant structure. Is the arc of aorta didn't go in the throat in the correct tract, and the descendant didn't go in the correct tract, but was a little bit posterior and inferior of the correct way, and this brings to the child a compression. Not every time this kind of variant of vessel can produce this kind of pathology, but in this case is enough closed space that can affect the esophagus and the trachea, and the children have a lot of problems with pulmonary respiratory pathologies, and the children 2 months ago performed a surgery by the surgery department, and now it's okay, fortunately. In conclusions, The most frequent pediatric emergency error, those of respiratory tract. A good history must be taken to arrive to a diagnosis, because sometimes we have misdiagnosed from patients and from their parents, and this can postpone the diagnosis. The early diagnosis is very important in these cases. Pediatric patients are not adult in miniature. Imaging is very important in establishing timely diagnosis. The recommendation, the use of all imaging methods, starting from X-ray, US, CT, enhanced CT, angle CT, are necessary for the diagnosis of airway obstruction. Here is the last slide that I have. I want to conclude. Thank you